I'm glad you've been enjoying our tour of beta-lactam antibiotics, and I can tell you can't wait to get to our next destination. But let's take a little detour. We've been at this, for 20 minutes now? Anyone else need a beverage? Look, I know a place. Now hear me out. It's a little rough around the edges. I mean, don't get me wrong, it's a great establishment. This planet has got a great night scene. It's just a little murdery on occasion. But when you sign up for this tour, I promise to show you the real beta-lactam antibiotics, not some phony touristy version. So remember, stay right behind me, never look a bounty hunter in the eye, never wait for him to shoot first. I know a guy who can get us in. Welcome to Amino's Space Cantina. In this sketch, we're going to be covering the aminopenicillins, amoxicillin and ampicillin, as well as two other broad-spectrum penicillins, piperacillin and ticaracillin. Take a look in the sky window, and we can see the same beta-lactam ringed planet to remind us that we're still dealing with beta-lactam antibiotics. Also, looming in the distance is the death caucus under construction, with cell wall structure exposed to remind us again that the mechanism of action of all penicillins is to halt peptidoglycan synthesis at the bacterial cell wall by binding PBPs, which were the construction workers before. This kills the cell, so they're bactericidal. In our tour so far, we have covered penicillin and anti-staphylococcal penicillins, antibiotics used primarily for gram-positive infections, such as staph and strep. And notice around the death caucus, we see clusters and chains of purple space stations. But let's take a look inside. A kind of gaudy yet tasteful red theme. That's because aminopenicillins retain the antibacterial spectrum of penicillins, but also have improved activity against gram-negative bacteria because of their enhanced ability to penetrate the gram-negative outer membrane. Because of this, they're considered broad-spectrum, and we will represent this with a prism hanging from the ceiling and causing a cool rainbow effect. Yep, aminopenicillins are just amped up penicillins ready to party. The aminopenicillins amoxicillin and ampicillin have similar spectrums of activity, but amoxicillin is better absorbed orally. Amoxicillin will be represented by an ammo box, a recurring theme from Sketchy Micro, and will emphasize oral bioavailability here with the open mouth of our rebel pilot, or smuggler? Mercenary? All I know about him is that his name is Hancillin, and it's probably best not to antagonize him while he's bored. He looks like the kind of guy that shoots first and asks questions later. Hancillin is wearing a red bandana around his neck to remind us that oral amoxicillin is often used in children to treat strep throat, caused by strep pyogenes. Amoxicillin is also given orally to treat sinusitis, otitis, and respiratory tract infections, often caused by strep species. All of these are represented here on this shady character in the middle of some kind of secret, probably perfectly legitimate deal with Hancillin. Also notice that he's plugging his ears. And he's got some kind of gross and socially awkward goopy stuff dripping from, are those head tubes? Well, amoxicillin is effective in treating otitis media and sinusitis, often caused by strep pneumo, H flu, and moraxella. Take a look at that chest plate, too, and notice the dented, rusty lung spots, probably from quite a few altercations with smugglers as he tries to reclaim his boss's debts. Amoxicillin is an option when treating pneumonia because of its activity against strep pneumo and H flu. To highlight aminopenicillin's effectiveness against H flu, in the sky window above we can see the H flu plane from Sketchy Micro. Now an H flu spaceship, notice the H structure in its wings. Also important to remember is that amoxicillin is part of the triple therapy for H. pylori. Hancillin is a pilot, of course, a helicopter pilot, and his Helicobacter helicopter is in the hangar behind him. All alliterations aside, amoxicillin is also an option for treating Lyme disease, if early stage or in young children. And Hancillin is more than just a smuggler, but a mercenary. His next target, pun intended, is Robin of Exodes, a recurring symbol for Lyme disease caused by Borrelia burgdorferi transmitted by the Ixodes tick. He's a wanted space outlaw, of course. And be sure to check out our Sketchy Micro Lyme disease video that features a northeastern Borrelia bow and arrow tournament. Okay, why is that alien rife with streptococcal infections plugging his ears? Well, this is a cantina after all, and no cantina is complete without a band. We've got a guitarist here hooked up to an amp to remind us of ampicillin, and his guitar cord looks like ivy, representing IV administration, because when ampicillin is given IV, it's useful for treating serious infections caused by anaerobes, such as aspiration pneumonia, hence the gas mask, our recurring sketchy symbol for anaerobic coverage. Also, ampicillin treats Enterococcus, a resistant bug that causes UTIs and endocarditis. Enterococcus was represented by a rock concert in Sketchy Micro. And next to our guitarist, we've got a drummer, ready to rock, with a purple double bass drum highlighting the gram-positive diplococcus shape of Enterococcus. Because resistant strains are important, we've made him a little too heavy metal, and he's kicking over one of the amps as he rocks out. This resistance is due to the production of beta-lactamases. Listeria, an important cause of meningitis in infants and the elderly, is also treated with ampicillin. And notice that our star shredder is wearing our recurring meningitis space helmet with the red meningitis mohawk to symbolize meningitis in young patients. Right behind him is tonight's set listeria. Get it? When a question on an exam points to meningitis, always think of very young and very old patients who might require the addition of ampicillin to their regimen in order to cover this bug. Okay, take a look at the bar. We can see the red gram-negative theme, of course, but take a look at these taps for fermented galactic libations. Looks kind of intestine-y. I just wanted to remind you that the aminopenicillins are effective against gastrointestinal and urinary tract gram-negative rods, like E. coli, though they are not likely the first-line drugs, and this is low yield for an exam. Ampicillin and amoxicillin are beta-lactamase sensitive, just like penicillin. Remember those beta-lactamase troopers with the plasmid ring guns from the penicillin sketch? Well, here's one now, a beta-lactamase bouncer. On the lookout for suspicious characters. He looks intimidating, I know, but we're on the list, don't worry. To combat beta-lactamases, aminopenicillins are often paired with a beta-lactamase inhibitor, for example, amoxicillin with clavulanate. This helps them prevent being cleaved by the beta-lactamases. If we take a look at the sign out front, it looks like the beta-lactamase bouncer is making sure that no smuggled ammo is allowed inside. But clavulanate is inhibiting the beta-lactamase, represented by this clavulanate clarinet player who's distracting the beta-lactamase so that ammo can be smuggled inside. So as you can see, amoxicillin is paired with clavulanate, also called augmentin. Other beta-lactamase inhibitors include sulbactam and tazobactam. So next to our distracting clarinet player, we'll add in some tambourine players standing back to back. Ampicillin is often paired with sulbactam, also called unison. Always remember the addition of that back tambourine. The addition of beta-lactamase inhibitors extends the activities of these penicillins so that they're not cleaved by strains of Staph aureus, for example. Now they're really amped up. So amped up, in fact, that one of our rebel fighters over here is using some force on this guy's face, if you know what I mean. He has a hole torn over his upper left abdominal quadrant to represent asplenia. Asplenic patients are at higher risk for infection from encapsulated bacteria, such as strep pneumo and H-flu, two bugs highlighted in this sketch. Amoxicillin specifically provides good coverage, and it's used as antimicrobial prophylaxis in very young patients post-splenectomy, and in asplenic patients with fever. Notice that the other guy's tooth is flying out. This is to remind you that amoxicillin is also used as antimicrobial prophylaxis before dental procedures, in patients at high risk for endocarditis. One more thing to point out. As he's dished the old chin music, we're going to sketch in a red mask falling off of his face. This is going to be our sketchy symbol for Steven Johnson syndrome, and it's here to remind you that aminopenicillins can cause rash that can sometimes manifest more seriously as SJS. As you can see, things get pretty out of hand at Amino's Cantina, and we're likely to experience a few adverse effects. Worldwide, amoxicillin clavulanate is one of the most commonly reported causes of drug-induced liver injury. Let this little guy with the big liver spot getting trampled on by the Cantina patrons remind you of this liver injury. Another thing to remember, ampicillin and amoxicillin can be associated with skin rashes when prescribed in the setting of viral illnesses, such as an acute Epstein-Barr virus infection. So take a look at the red flashy lights on Epstein's Barr on the far side of the room. Alright, before we head out of here, we're going to run into two more extended spectrum penicillins in this sketch. They're not aminopenicillins. These are the big guns piperacillin and ticaracillin. Piperacillin because they're rocking the pipes, and ticaracillin because they're wearing the hip tiger stripes on their jumpsuits. Just like ampicillin and amoxicillin, these guys are also paired with beta-lactamase inhibitors. Piperacillin with tazobactam, one of our tambourine players, and ticaracillin with clavulanate, the clarinet player. Remember that these combinations are used so that they don't get cleaved by beta-lactamases. It's also important to remember their broad spectrum of coverage includes anaerobes, like those that cause aspiration pneumonia. Anaerobic coverage will again be represented by these gas masks. The most important thing you can remember, though, is that they are active against Pseudomonas. And here, piperacillin and ticaracillin are wooing a space female with the most enigmatic smile in the entire galaxy. Representing Mona Lisa, of course, our recurring symbol for Pseudomonas. Pseudomonas coverage is important to consider in hospital-acquired infections, and in patients who are at risk for multi-drug resistant bacterial infections. So because of their broad spectrum of action, including activity against Pseudomonas and anaerobes, pip-tazo and co-ticarclav are used for serious infections such as hospital-acquired pneumonia and empiric treatment of sepsis. Well, that's it. Let's sum up this sketch. Aminopenicillins have extended gram-negative coverage compared to penicillin. Remember that amoxicillin is good for sinus infections, respiratory tract infections, and acute otitis media, and that it has coverage for H. pylori and Lyme disease. For ampicillin, remember that it's good for that listeria meningitis in young patients. For ticaracillin and piperacillin, these are your big guns that have anaerobic coverage and can also cover Pseudomonas. And all these guys are paired with beta-lactamase inhibitors so that they aren't cleaved by beta-lactamases. And I forgot to mention, remember those side effects of penicillins and other beta-lactams that we covered in the penicillin sketch. Alright, in our next scene, we recruit the help of some charming yet ruthless cephalopods.